When you use these bands, don't use so much resistance that you keep them from reaching the ultimate and complete full range of motion throughout your particular movement patterns. Remember length-tension relationships. If you're too short on one side and too long on the other side of the joint, you're not going to be able to activate, and you're probably not going to be able to get into the range of motion you need to. And that's where your manual therapy techniques may come in. The stability bands are used to activate end range of motion as well as to control movement out of that end range of motion to maximize our eccentric contraction, have as much eccentric focus as we can on these stabilizers. So the movements must be performed slowly and technically flawless at first. So I always say, if I hand you 3 balls and you don't know how to juggle, well, you're gonna have to learn how to juggle 1, then you're gonna have to learn how to juggle 2, then when you're able to juggle 3, then we'll think about throwing maybe in some knives and some chainsaws and making juggling really difficult. And that's the way you kind of have to look at these exercises in their progression. You want to start in the most stable position that your patient or athlete or client can perform the exercises correctly, and then progress from there. Sometimes you have to back them all the way up to maybe a supine position and really give them a lot of stability, and as they progress, move them into side lying and so on and so forth until you can get them standing. If someone's really good in the tall kneel and quadruped position, then get them upright as quickly as possible.